All right, ladies and gentlemen, we'll be starting in the next 2 minutes. If any of your friends or fellow volunteers have to join, please notify them. We'll be live on YouTube as well. So if someone is not able to join right now, they can look at the video and learn from it.
You can mute everybody and
Yes, sir, that's already done. So without further ado, I would like to introduce you all to the trainer for the day. So we have the president-elect of Rotary Rajmahal Vilas, Rotarian Shankar Subramaniam sir with us. He's a fantastic photographer and he's been one of the faces of RMB when it comes to the PHC management, and they have first-hand experience in taking care of these PHCs very effectively. So today we'll be going through how to volunteer at the PHC in a safe way and what are the do's and don'ts. All these things will be taken through, and if you have any questions, we can take it towards the end. Okay, so we are at 9:30. So thank you so much for agreeing to do this. And this is an initiative from Rotary District 3190 in association with Rotaract District 3190 and Inner Wheel 319. So the COVID war room from 3190 is getting activated on May Day. It's truly a May Day for us. We remember listening to May Day on flights which are about to crash, right? So it's been such a scenario, and now it's time to bounce back and take necessary action. And volunteering at PHC is one such initiative. So, Shankar sir, without further ado, over to you.
Can you make me co-host, please?
Sure, sir.
On both the devices.
Both the
There's
devices.
one Shankar Subramanian and the other one is Rotarian Susha and Shankar both.
One second. Done, sir.
It still says the other device. One more device is there, no? Shankar Subramanian. Make that also.
Yes.
Co-host.
Done, sir. Both the devices are done. Yeah.
You're able to see the screen, everybody? Krishna, just let me know if you can see the screen.
Yes, yes, sir. Please go ahead.
Okay. So a very good morning to all of you. I think there are people in the waiting room. Please do admit them. And maybe you can remove the waiting room now so that you don't have to be wasting time.
Yes, sir.
I'm expecting some material to be sent to the COVID care center. That guy might arrive anytime. So if you do, I need to take a couple of minutes just to step out and give him directions to come to my place. So please pardon me in between if that happens. You can just just wait for a couple of minutes while I come back. Okay, so I'm telling you in advance. We are in midst of this huge whole lot of coordination and pandemic and stuff like that, and it's more like a war situation at this point of time. And what is it that we could do, all of us, is that we could help with the public health center, which is doing the vaccination. Now, why should we help with the vaccination drive and what is there? So I will present it like a case study as to what is it that we've been doing for the last 2 months, and then you need not do the same errors and mistakes that we have been doing in the past. So what is a public health center basically is a small little hospital. It could be very small, it could be slightly larger, And those of you who've been involved with Pulse Polio, you would probably know that that's where the polio vaccination drives happen, and volunteers go out from the public health center and they go, and some people come to the public health center for the polio vaccinations. So this is not something that is new to us. So most of us are familiar with that. But in case you do not know what a public health center is, this is a government BBMP run small little hospital for emergencies, exigencies. People below the poverty level, they come there. They're pregnant women who come there for some treatment, medicines. There are people who have come with dog bite. People who had a fall, they come for some emergency support. So the public health center takes care of all these things. Now what is it doing? It is now taken over the responsibility of the vaccination and testing as well, added to what they were already doing now. So you can imagine the load on the same staff. And now you have around 100, 150 people coming to this place. And you can imagine that they really don't have the staff to manage this kind of an exodus. So what can the Rotary do? The Rotary can get involved in seeing that this vaccination drives are happening smoothly, and they can be a part of it. So I want to tell you what really happens at the public health center, and then we can open out for questions. So there is no space in the public health center for the people who are waiting for the vaccination. So what we have done at the Rotary is that we have hired the chairs from our end, and we arrange the chairs before the vaccination starts. And here you can find one of our Rotarians well protected. This is my wife, Usha, Rotarian Usha, who's there. She's wearing gloves. She's wearing a double mask, and she's wearing a shield. She's also wearing a thin jacket, which you can get in maybe a sports store like Decathlon, maybe more like a thin rain jacket that is there. So kind of a PPE kit kind of a thing. So one of the things that we need to remember is whoever is going to volunteer at the PHC, they need to be safe. All right. There's no point in volunteering and compromising ourselves. There's no point in going there without a mask and doing all kinds of adventures there. This is not done. So whoever is the Rotary Club which is in charge, or the Rotaract Club is in charge, is to make sure the volunteers are protected. And that is a very, very important aspect. All right. And so this is what we've done. We've we kind of organized the chairs, and you see our volunteers are putting the chairs. Now what will happen is sometimes people are anxious and people have anxiety, and we have spaced out the chairs. So slowly, what happens? They're afraid where the chance will go away, and they start bringing the chairs together. So all these things we need to manage, and we have to be very nice and polite to people. You cannot order them around. They get everybody is on very, very anxious, and they're in pins, and they can get angry very quickly. So please remember that you're volunteers. You're not the authority. That's a very important aspect that you need to keep in mind. You are not the authority here. You are not the police. You're not the BBMP. You're just a volunteer. And that has to get into our heads very clearly, that you're just a volunteer. You're just helping out. Okay? So you cannot order people. You cannot threaten people. You cannot do any of these things. You have to be very, very polite, very patient through this entire aspect. Okay. Now, this is just outside the public health center, and today we have just started, making small tokens there. So one of our Rotarians is sitting there making tokens. Now, we didn't earlier start this token system because what happens is people will take the token and go home, and then they'll come there, and then they'll start coming in front of somebody else. The person who's waiting there will say, "How did this guy come in?" And there's a fight starts there. So that leads to all. So far we've done only first come first serve basis. Today onwards, they have started a small experiment trying to see if the token system can work. And today only 60 vials are available today. So it's going to be a smaller crowd, but they're going to see how this token system can operate. And they're going to be giving tokens to people so that their anxiety can be reduced. So that's one of our past presidents, Sanjay Krishna. He's writing the tokens and putting the seal there. And we have a Rotary banner there. And one of the things that I would recommend you to do is all the volunteers wear Rotary jackets or Rotary branding there, so that it's also a great public image there. See, on the right hand side, you can see a elderly lady sitting there. Now, we have also made a provision for senior citizens to be given a separate counter there. So people who are above 70, people who have difficulty walking and all these things, we have seen there. Now, also you can see there is a ramp there. Now, the ramp was not there before. Now, with the help of the local support in the CFOS organization, we requested them to build a ramp. And because we found that a lot of people were not able to, get into the PHC, people who are disabled and having walking difficulties. So this is a ramp that we created, and now there was no wheelchair. You can see there's at the corner there. You can see here there's a wheelchair there, and that is also something that we have organized so that people can be brought in with a wheelchair. So all these things were not there before. We also, what we have done is we have put up posters there about people wearing masks. And this is another big thing. People wear the mask here, people wear the mask here, and all kinds of things. So we have to go around requesting, please, sir, wear your mask, please wear your mask. And of course, our volunteers also, you find Usha there. She's in this bag. She's also carrying a few masks there. Okay, so in case people don't have a mask, then she doles out some masks so that people can wear the mask. So this is something that we need to ensure that the vaccination center does not turn out to be another place where COVID spreads. Okay, so this is the scenario. So let's see if we can get a view inside where it is. Now I'll tell you how small this place is. I'll show you in a while. Okay. Now this tent on the right hand side, I'll come to you what this tent is there for. I will tell you in a while. Okay, so you can see that we have noticed that the vaccine starts at 9:30. This picture was shot at around 8:30. So already there is at 8:30, people are already waiting for the vaccination to start. Okay, and people are getting ready. And this is way away from the vaccination center. The queue has gone one big circle around the small little hospital. So you can imagine where the line is. Now, what happens is that this is where the first point of contact when they come inside the hospital. This person takes the Aadhaar card, phone number, and everybody asks a question. Have you already registered? If you're already registered, it is easy for them. If they're not registered, then they have to enter all these details: Aadhaar card, phone number, name, everything they have to enter. Meanwhile, they also check whether you had breakfast. Do you have fever? Do you have allergies? Are you on any medication? There are some standard set of questions. Now, the moment that he finds that there is something that is not fitting, immediately calls for the doctor and checks that look, this is there, because the PHC cannot handle emergencies. So they don't want to take a risk with anybody who is having some kind of a issue, and therefore they want to be safe in telling them to go to a hospital where there is an emergency emergency facility available. All right. So there are some standard set of questions. Now, what do we do here? We have one more volunteer who's sitting next to this person writing the register. Now, don't ask me why they write the register. It's part of the process. They have to write one register with the same details with their entry, Aadhaar card and everything. That takes time. Now, earlier, the same guy used to be doing it. The queue used to get slowed down. Now, we put in one person there as a volunteer. And today onwards, we have a paid volunteer who's sitting next to this person and who's actually writing the register so they can speed up this queue. Okay. Another thing that can happen is the system can slow down. This is a very ancient system. The system can slow down. And if this slows down or this congs off, the network congs off, then we have to manage the crowd outside. We have to manage the people outside in giving them information. Now, what is also happening here is what Usha is doing is she is also telling people what is expected out of them, and they should have had breakfast. There are a set of instructions that need to be given to them, that they should have breakfast, they should have their Aadhaar card, they should ensure that they're wearing a mask, and how long this will take and what is the procedure. All this is being explained to them so that they know what they can expect before they come in here. Okay. So once this is done, then they get into this vaccination center. So this is where the vaccination happens. Again, there's one more register here. One more person from our club is sitting there and writing the register here. So that all these people can be tallied, that the person came there, registered, and then they came here and they got vaccinated. So all these records need to be submitted at the end of the day by BVNP to the central information system. So all these things happen there. Mind you, all this is happening with skeleton staff. Okay. And after they finish their vaccination, they need to wait for 30 minutes to see if there are any kind of reactions, and then only they need to go. People who come there, many times they want to leave in 5 minutes time. So we need to keep a watch of this. So there's one more Rotarian here who's actually keeping a watch on these people to ensure that they don't leave immediately and they run away. So we need to make sure that they can wait there for 30 minutes before they can leave. So you can see that in the small little place, all these things are happening. Now in front of this is the computer. Now in front of all this thing is where the computer space is. So you can see the computer is in the small space. This is there in the small space, and then the vaccination is there. Now, apart from all this, the PHC is also catering to dog bites, to medical, small little medical emergencies. Somebody had a fall, the nursing, and some pregnant woman, they come to get some medicines. All these things are there. Now they have a separate queue outside, and the doctors are attending to them as well. Okay. So this is where the main doctor is sitting, and the doctors are sitting, and they don't allow anybody to come inside the doctor's room. They come out and then see whenever something is required, then they come out there. Okay, so this is the scenario. Let me also see. Sundar was supposed to send me some more pictures. Let me just check if some pictures are there. Give me a minute, please. I'll just okay. So there's one more picture here, and now on the side here, there is also a COVID testing center, by the way. And this is also manned by the BHC. But this is a separate entrance. That blue tent that we saw there, this is the this is the side of that COVID testing center, and this COVID testing is happening there. So people who need to come and get their test done for the COVID testing, there's another queue for this, and there's a separate queue where people are waiting there to get the COVID test done. So this is on the other side there. So all this is happening in the small PHC. All right. Now, what are the other things that they do? Sometimes people have not had breakfast, so they send them and make sure that they have breakfast and come back in a nearby restaurant or whatever it is. That's another thing that the volunteers are checking. And sometimes they bring some biscuits, bananas, and distribute it to the people who are standing for a long time, and the doctors and the nurses, and see what they can do. The small things keep happening. So this is briefly what we do at the PHC. If you have any questions, I will open it out. I got another 10 more minutes. I can open it out for questions.
Thank you, Shankar sir. I had a question with respect to few scenarios. As you were mentioning earlier, we are volunteers and we have to make sure that we handle things in a very peaceful way. And there might be scenarios where it might go out of our hands. So any other scenarios that you would want to mention where they were desperate and it was difficult to handle, and how you handled it? You're on mute, sir. Shankar sir, you're on mute. Meanwhile, I request all of you to kindly type in your questions, or if you have a question, you can raise your hand and we'll unmute you. Shankar sir, kindly unmute. Giri sir, did you have any question? Okay,
I didn't
Anuradha
know I
ma'am.
got disconnected on the other device. My apologies. Sorry.
Uh,
Sorry about that.
no problem, sir. Anuradha ma'am has a question. She's raised a
Yeah,
hand.
please. Please.
Anuradha ma'am, go ahead.
Yeah. Sir, I stay on Bannerghatta Road,
Yeah.
and my nearest PHC is Begur,
Hmm.
Begur PHC.
Hmm.
So I being a homemaker, how can I volunteer at PHC with all safety measures? So
See, my,
husband,
yeah,
son, and 87-year-old father-in-law.
yeah. My recommendation is that preferably we have
Hello.
can you hear me? Anuradha, can you hear me?
Yes, sir.
Yeah.
Yes, sir.
So my recommendation is that
I can hear you.
1 minute. Madam, caller lidini on 2 minutes now. I'll just call you. So I preferably my recommendation is that either we have a paid employee, and then say paid employee, you can get a volunteer and give them some small payment from the club, and somebody who's young and who can contribute, and who can follow all these safety instructions. That's one way to do it. Or you find somebody in the club basically who are fairly less than 45 and request them to volunteer. These are all the things that one can do. I would not recommend that somebody who's above 60, above 50, to be around in the PHC at this point of time. That's my recommendation. Even though some of our Rotarians are there who are above 50 who are volunteering at this point of time, but they're taking a lot of safety measures, and to ensure that, as you can see, there are following a lot of safety measures. But if we can find some youngsters to take that role on, that would be preferable, ma'am.
Thank you, sir.
Any
Thank
other
you.
questions? Any other questions?
Sir, with respect to the PPE kit and other things for the volunteers, so in all the PHCs, is it?
Yeah, PPE kits will not work. Even the doctors, nurses, nobody is wearing a PPE kit because it's not a COVID center. A PPE kit is required only in a COVID center. This is not a COVID center, and we don't allow anybody with a fever and all those things coming inside. So that's another thing that the volunteers could also do. We are not doing, but you can have this thermal thing and just check the temperature of the people. And anybody who's having a higher temperature, you can direct them to the separate counter where they take care of fever and other things.
Okay.
So most people who are healthy people only come to the COVID center for vaccination. The people who have got fever and all that, they don't come.
Okay.
So that way it is safe, but still we need to take a precaution. That's what we need to ensure that we are protected. Yeah.
Sure, sir.
Any other questions?
If you have any other questions, again, please voice it out on the
Because
chat
I
or
want
raise
to
your hands.
make it a presentation and stuff like that. I thought I'd make it interactive so that if anybody has any specific questions on how to go about it and things like that. Okay, if no questions are there, I'll also keep sharing things till we find a question. Now there will be people who will barge in saying that, okay, I'm the MLA, I'm the minister's reference, and I'm stuff like that. But there are certain people whom we need to give preference, and those people are basically the police, the doctors, BBMP, frontline workers. These people need to be given preference there, and that will be directed. That guidance will be given by the PHC. They will tell you as to whom the preference need to be given, because they are all on frontline duty and they need to get vaccinated, and then they need to be sent across. And we need to ensure that there are no conflicts there, and you need a lot of maturity to handle those conflicts, because the people come there, they sometimes they can just get angry for no reason at all, and we need to be very calm and patient to manage those tempers and temperaments at that point of time.
Perfect, sir.
So
Sir,
sometimes, the vaccine may come a little late. For example, in one day, the vaccine came at 10 o'clock. People were standing from 8 o'clock. So 2 hours, they were already waiting. So they were getting restless. So sometimes things like this can happen, because this is a kind of, like I told you, a warlike scenario. And anything can happen. But we need to be patient, and we need a lot of patience to manage the situation. Yes,
Raj had a question, sir.
Raj, go ahead, Raj.
Yeah, morning, Shankar. Shankar, I had a question regarding this volunteers from the Rotractor side.
Yeah.
So, are they allowed to be part of this program? Can we use them also for monitoring this PHC centers?
Like what I would like to request you is that Rotractors need to work with Rotarians, along with Rotarians, and form a team, and then be part of this thing. We have Rotractors coming to the public health center. They come on weekends because they had some college and all that. So they come on weekends and support us.
And is there any BBMP protocols or rules and regulations which BBMP will set? This is our understanding. I think it was a fantastic session what you delivered today. But I wanted to know, like from BBMP side, is there a criteria? Is there a requirement to be volunteers for PHCs?
We have not evolved to that stage right now. It's like a war scenario. We got just a call. Actually, all this thing started because we got a call from the doctor at the public health center, and she said, "Can you help us?" And then all the things we started, and we got involved, and then we started how to manage the crowd, how to make the seating arrangements, everything. We have been learning on the fly from this thing. So. And whatever learning has happened from a volunteering perspective has happened from our end.
Okay, thanks, Shankar.
So I didn't want you guys to make the same mistake. So that's why the idea is to have the session is also to ensure that when you guys set up something in a PHC, it is smoother and easier. And I would also recommend that small teams like Abhigare, the Rotarians from Abhigare came and they observed what we were doing. So you can also come to the Sanjay Nagar PHC and we can give you a first-hand, feel of what needs to be done, and so that you don't have to make the same mistakes that we did along the way. So there are 4 roles basically: 2 people who need to write the registers, and 2 people are required to manage the crowd. So totally, if there are 4 volunteers, you can manage a PHC.
So we have one more question from Rotractor Kiran. Do we require any pass to go for the PHC? So that is 2-ended question. One is for people who want to get vaccination, and one more would be for the volunteers.
Yeah, people who are coming for the vaccination, they need not get any coupons or anything like that. They need passes. But if any passes need to be organized, the BBMP, you can request the doctor, they will organize it for you. Not an issue. And that's why wearing all the Rotary and Rotract jackets and all those things also helps. You can say that you're going to volunteer at the local public health center, and people are okay with it. Anuradha has got a question again.
Yeah.
Sir, which is the nearest Rotary Club for me on Banerghatta Road?
Maybe Krishnarjun, you could probably take this offline and maybe help Anuradha with that query.
Sure, sir. I'll do that.
Soumya has also raised her hand. So can we have a question from Soumya?
Yeah, so I wanted to know, so you said volunteers should preferably be in the less than 50 age category, isn't it?
That's right. I mean, that's our recommendation.
So I understand.
Even though we have a few Rotarians who are above 50, so actually, they've been there for the last 50 days.
Right.
People have been there for the past 50 days, but because they are taking a lot of precautions, they're safe.
Yeah, so I wanted to know if we wanted to organize vaccine drives at other than PHC locations, and in those local locations, if volunteers are ready to coordinate crowd and do registration help and so on, can Rotary organize that?
I do not know at this point of time. There is a question about the availability in
Yeah,
large
true.
That's one, and there are some private.
They're also citing availability issues. We've been exploring for our community.
So there are private organizations which do that. The idea is that, see, it has to be done in association with a hospital, because if there are any kind of emergencies, then the Rotary should not get a bad name in thing. That's why working with a PHC is always better, because it is under the BBMP that we are doing this.
I understood. Thank you.
Raghavendra, sorry, Ravi Chandran sir.
Ravichandran.
Yeah. So a couple of things, inputs. One is most of the time we see the glitches happening. Okay. And second thing is certificates are not uploaded properly. My own case, twice it happened. One. Second thing is you can also have minimum of 100 people can be vaccinated at a time. The BBMP will set up the complete thing, whichever place you want. Okay, you have to contact your a hospital in charge, their administrator. He will help you to set it up. You will give a time, they will come and do the needful. Okay, and also I have many contacts who can do either cost or without cost. I can share it.
Okay, okay. Thank you, sir. Thank you for sharing that, sir.
Rotractor Kiran had a question with respect to how long you can volunteer. I'll unmute him as well if he wants to clarify the question.
Yeah, please go ahead, Kiran.
Kiran,
Can
unmute
I-
yourself. Yeah, Kiran, can you hear us? Hello.
Yeah, what was the question once again?
How long can you volunteer was his question, sir.
I mean, see, okay, probably you're talking about the timings. I'm guessing the timings. So
Yeah.
a PHC, what we are doing is approximately 100 to 140 vaccination per day. Okay, and it takes from 9 o'clock to 3:30 on a long day by 3:30. Otherwise, by 2 o'clock it gets over if it's on 100 vaccination. But if it's around 140 or something like that, it goes up to 3:30, 3:45. And what I would suggest is that they can make a small calendar and take turns. Let's say from 10 to 12, one rotractor can come, 12 to 2, another rotractor can come. It can help.
Definitely, sir. So I think we're at the end of the Q&A.
Yeah.
Kiran was asking whether he was audible. No, Kiran, you are not audible, but hope that question was answered by Shankar sir. If not, you can pull it up on the chat section. So the way forward will be trying to get trained on each of these aspects. With respect to the war room, we'll be focusing on getting people up to speed with respect to counseling. We'll have phone lines that will be operational. We'll have data related verification and validation before anything gets forwarded on social media handles, as well as on our private WhatsApp groups. So all these things, whoever has volunteered for volunteering at PHC, if you go through this particular video, this is the first of its series where you'll understand what are the do's and don'ts in the PHC. And in the coming days, we'll see if we can do a virtual tour from the PHC as well. Shankar sir is a fantastic storyteller through photographs, and he has managed to give us that experience through his photos. So we understand what are the things that are currently happening, and we might also speculate on what are the things which can be done even better in a few of the other PHCs that we will be taking up. So first thing is optimizing our timetable so that this can run for a longer time. We shouldn't get exhausted just 3-4 days putting all the effort. So optimizing the utilization of our resources and time, and volunteering in the nearest PHCs to us, so that travel also will not be a hassle. And through, if as Shankar sir said, if Rotary clubs are able to adopt PHCs, there's a big requirement of that as of now. So if Rotary clubs can come forward in adopting and mobilizing the Rotary family, the younger crowd to come and volunteer, I think it'll be the best fit.
One more thing I want to say, it's a great opportunity for public image and service.
Yes.
This does not require any money. It just requires the people to be there on the field. And, if we can show kindness, and we've got around 3 people who wanted to join the Rotary from the group of people who came there. So already. So there's also a great opportunity to increase membership.
Definitely, sir. I totally agree. Abhay sir had one question. I think this might be the last question for the day.
Sure.
Abhay sir, please unmute yourself.
Good morning, everyone.
Morning, Abhay.
My apartment is just next to Malasandra PHC, and other than, of course, we are about 4 Rotarians here, and so our Rotary families we will be volunteering at Malasandra PHC. We also have one more PHC down at Chikabadavara. Non-Rotarians in our apartment also want to volunteer. Can they?
Yes, sir. We have to be very careful. Okay. I think Krishnarjun is making one, disclaimer certificate which he is doing. So I would request you to please get it signed by the non-Rotarians. And you need to also talk to the doctor. We have to work very closely with the doctor. So first we need to talk to the doctors and say, this is what we plan to do. This is what we want to support you. And we need your guidance as to how to go about it. So go with the guidance of the doctor. And the volunteers you're bringing in should be responsibility of the Rotary Club, which is actually managing it. Because sometimes what happens, a volunteer will go there and pick up a fight with somebody there. So he will say, somebody will come and say, social distancing illa. Because you see the space that we have, you see how much within that we are trying our level best to maintain social distancing and everything. But after we move this side, some volunteer moves this side, some people bring the chairs next to each other, and suddenly one more person will come and say that notary then one fight ensures, and the volunteer gets into the fight as well and becomes a scenario. So we have to be very careful that the people whom we are choosing have the maturity to handle such kind of tough situations. So that is the important part there, Abhay. So definitely, yes, you can include some more people. We can definitely get friends and family to help out, but we have to take responsibility for that. Hope, Abhay, that answers your question.
Yes. Ravi sir has one more comment, I guess.
Yeah.
Ravi sir,
Yeah.
please go ahead.
Thing is, that's what I've been doing is there are 2 shifts normally. See, people come at 9 o'clock for registration, and the vaccination will happen till 1, and then again after 2 p.m. till 4 they will do the vaccination. So it will be better 2 volunteers or 4 volunteers, 2 in the morning and 2 at 1, between 1 and 5, and between 9 and 1. That will be the best combination. So 4 volunteers per PHC or whatever this they want to volunteer. That will be ideal.
Thank you, sir.
So I think that then we can.
Yes, sir. We can conclude the session. So an initiative from our DG, Rotarian Nagendra Prasad sir, and district leaders from Innerwheel as well as Rotractor Rajvamshi, our DRR. Everyone has come together to do something for the welfare of the society at these testing times. So thank you, Shankar sir, for handling this session beautifully. It was really inspiring, and I'm pretty sure many of us will be volunteering at PHCs very soon. And please make sure you stay safe, folks. We know we are trying to serve the society, but we shouldn't put our families and ourselves in danger. So take extra care of yourself. And thank you very much, everyone, for joining in today.
Krishnarjun, before we conclude, I'm working very closely with the requirements of the COVID care center also that we are supporting. And they want a lot of things like medicines and, things like body bags, stretchers, oxygenators, oxygen masks and everything. So I'm trying to organize everything. So if anybody would like to partner with us, please feel free to get in touch with me. Krishnarjun, you can probably leave my contact there in case anybody wants to contribute or partner with us to support the COVID care center, not the PHC, but the COVID care center.
Definitely, sir.
Thank you.
All right. Thank you, everyone. Have a great day.